Doctors and nurses say hospital patients should be active participants in their health care. Recovery may be faster with a lower risk of readmission. But we don't always think clearly about our health, especially in the middle of a crisis.
Typical male, thought a little discomfort, but it was never the, I'm having a heart attack in my chest. It was in my back, and it was just an excruciating pain, pressure.
He couldn't really move his arms real well, and he was really sweating. And I had read in previous magazines and stuff kind of signs of a heart attack. So I'm like, are you sure you're okay? And he's like, I'm fine, I'm fine.
I think in the back of your mind that something's not right, but a heart attack was the furthest thing from my mind. We probably got about 3 blocks from the hospital, and that's, I remember turning to her and saying, Trace, I'm in trouble here, another red light, and it probably wouldn't have been good.
Judith also had a heart attack without recognizing the symptoms.
At about 4:30, I woke up just unable to get any breath whatsoever. And then one of the dogs started barking. My neighbor downstairs, Brian, heard the barking, came up to find out what's going on. What I thought was that this was some kind of an asthma attack.
For 3 days, Judith dismissed the seriousness of her trouble breathing, despite being a supervisor at a 911 dispatch center. Every day, she helps other people with health emergencies.
So Thursday morning at 4:30, it was that same, I can't breathe. And at this point, it became clear that there was something more going on than just asthma, or if it was asthma, a couple of squirts of the albuterol wasn't going to solve the problem. So I sent Brian a text on the cell phone saying, help. So Brian called 911, and off we went.
Thinking clearly in the middle of a personal medical emergency isn't easy. It doesn't necessarily get easier at the hospital.
Well, I think in the real world of hospitals, it can be pretty tough to be a patient these days. It's very sensory overloading. There's a lot of people around. It's very fast-paced.
It definitely can be a burden when the patient's in the hospital and they might be in pain, they might be exhausted, they might be feeling extremely vulnerable because they're in an unfamiliar situation and unaware of what the outcome is going to be.
So it can be very helpful to have an advocate, a friend or family member who can help listen, write things down, and generally help keep track of what is happening.
And I think it's important for them to write down their questions, but if at all possible, to have a caregiver, a family member that's really watching out for them.
Together with a caregiver when possible, patients should review with their hospital team information that can help ensure a smooth discharge and good recovery afterward.
I encourage patients and their caregivers to develop a checklist of what they need to know while they're in the hospital and know at the time of discharge, and what they need to do once they leave the hospital.
First on the checklist, what happened? Understand the diagnosis, treatment, and tests. What test results are pending, and what tests are still necessary? Second on the checklist, know your medication and how important it is to take it exactly as prescribed.
What medicine should I be taking? Right behind that question is, how do those medicines compare to, or are they the same as the ones I was taking before I came in? Mix-up in doses and types of pills is a fairly frequent cause of a need to come back to the hospital.
Third on the checklist, what are the warning signs something may be wrong and that you need to call a nurse or doctor?
What are the kinds of signals my body's given that I might need to pay attention to? So if I get this little twinge in my chest that, 2 years ago I would have ignored, well, now should I ignore it? Maybe not.
Fourth on the checklist, follow-up appointments.
Make sure before you go home that you have an appointment with all the physicians that you need to see and know how soon you need to see them. Many times you will have an appointment to see somebody within that first week or two after you go home. Keeping that appointment is really, really important.
Fifth on the checklist, understand important lifestyle changes in diet and exercise.
Finally, am I going to have to change my diet? What am I going to need to do from an exercise standpoint? How soon can I get active?
Sometimes everyday problems may interfere with recovery. Transportation may be difficult for follow-up visits to the doctor. A patient may be worried about meals or assistance around the home. Patients may not have enough money for their medications.
Financial barriers are tough, and they're tough to admit sometimes. I think the key is to let us know if you're having financial barriers, because there's resources out there. We can get you involved with social services, get you connected with a free medical clinic.
In room 50, he came in with...
Case managers and social workers can help address insurance, financial, and social problems. They coordinate home nursing care and can help patients apply to programs for drugs at reduced cost. And they are plugged in to community resources.
I often feel that patients under-request social work a lot, that they don't know that we're here, and a lot of times don't know what we do or how we can help, and I think people would be surprised as to what we can help them with and what we can do for them during their admission.
It is important that patients continue to ask questions, even after leaving the hospital.
And as you go into the transition, I'm going to give you a tip. There's one critical piece of the transition that is more important than anything else: a phone number. Make sure you have a number of a nurse whom you can call and say, hey, I made it home and I've got some other medicines here, or made it home and I'm trying to understand what's the right diet that I should follow now that I'm here. I'm trying to understand how much fluid I should have. These are reasonable questions. There is no such thing as a bad question, but make sure you have that phone number.
Coming up, the challenges facing patients as they return home.